At the Royal Preston Hospital, COVID-19 patients struggling to breathe are being supported by a new way of proning. That's a technique where patients lie on their front to improve the flow of oxygen. But instead of ordinary pillows, on trial is a new cushion-based system.
The size and shape of a lot of our patients, lying on your tummy can be quite uncomfortable. It can cause quite a bit of back pain. By using this support system, it's actually able to make this position for these patients much more comfortable and much more tolerable.
Moving conscious patients this way is one of the most effective treatments for coronavirus.
The simple idea is that if we can support the patient at their hips, support the patient at their chest, we have some space underneath where the diaphragm can expand and they can breathe more easily. We also use this head cushion here.
A Manchester-based company designed the cushions using a special foam after being approached by the University of Central Lancashire.
We developed about 4 years ago a new foam formulation which has pressure relieving qualities, but it doesn't sink like other foams. So the idea is you can manage posture and pressure at the same time.
Where previously they hadn't been able to tolerate more than 10-20 minutes, they're managing much longer periods for them actually to get the benefit of lying on the front and getting up to like the 2-hour mark, which is what we'd like to aim for with these patients.
Previously, the companies worked with patients suffering debilitating conditions such as MS.
With hospitals under a huge amount of pressure when it comes to dealing with COVID-19 patients, how could this help outside of medical centres?
Well, we're really hoping actually that if you do feel fatigued, we're going to see this evidence in the next 3 or 4 weeks that perhaps we could reduce the amount of hospitalisation because patients could self-prone at home.
One particular gentleman that we used it with, he said it was a revelation and it was absolutely amazing. And the most important bit was they actually fell asleep, and it was the first time that this gentleman had slept in some time.
Encouraging early signs suggest there could be a wider rollout, and that could help more patients fighting COVID-19. Eunice Muller, BBC Northwest Tonight.
SARS, I think, some of the lung